Let's be real, losing your job is tough enough. But then having to figure out the whole Medicare system on top of it, yeah, that can feel completely overwhelming. So in this explainer, we're just going to cut right through all the noise. I'm going to give you a clear step-by-step guide to finding the right coverage during this transition. Let's dive in. So you've been laid off after 65. That brings a whole different level of stress, doesn't it? Especially when you think about replacing your health insurance. But I've got good news for you. There is a clear path forward. We're going to break it all down piece by piece so you can feel really confident about what to do next. Okay, this is probably the most important thing you need to know right now. Losing your job's health insurance triggers something called a Special Enrollment Period, or an SEP. Think of it like a golden ticket. It's this penalty-free window that gives you the power to choose the best Medicare plan for you without any late fees. This is your chance to get your healthcare set up perfectly. So why is this period such a big deal? Well, because it's your chance to avoid a really common and expensive mistake, overpaying. A lot of people just rush and grab the first plan they see. This window lets you just pause. You can compare all your options, make sure your doctors are covered, make sure your prescriptions are covered. Taking your time right now is the single best thing you can do to lower your costs, both today and for years to come. All right, so you've got this special enrollment period. Fantastic. But what are you actually choosing from? To get that, we need to quickly look at the basic building blocks of Medicare. I know, it can seem kind of confusing at first, but I promise, it's a lot simpler once you see how all the parts fit together. So the starting point for literally everyone is Original Medicare. It's made up of two main parts. You've got Part A, which is your hospital insurance. Think of it as covering your room and board if you're in the hospital. And then you've got Part B, and that's your medical insurance for things like doctor visits, lab tests, and outpatient stuff. This combo, A and B, that's your foundation. Okay, so you have your foundation with Parts A and B. Now comes the most important decision you're going to make. The entire Medicare puzzle really just boils down to choosing one of two main paths. The choice you make right here will shape pretty much everything: your coverage, your costs, and which doctors you can see. And here it is, that fork in the road. On one side, you've got Path 1. You stick with that original Medicare foundation and you add a Medigap plan to fill in the cost gaps, plus a separate Part D plan for your drugs. Then on the other side, there's Path 2. You go with a Medicare Advantage plan, which kind of bundles everything into a single all-in-one plan. Let's take a closer look at each one. First up, let's explore Path 1. This is where you combine original Medicare with a Medigap policy and a Part D plan. People often call this the flexibility and predictability path, and for good reason. It lets you build a really comprehensive, customized plan on that foundation we just talked about. You know, the biggest selling point for Medigap is freedom. Total freedom and predictability. You can see virtually any doctor, any specialist, anywhere in the US that accepts Medicare. No networks, no referrals needed. This also means your medical bills become incredibly stable. You know what you're going to pay, which gives you amazing peace of mind, especially if you're managing any ongoing health issues. But of course, that freedom and predictability comes with a trade-off, and that's a higher monthly premium. You're basically paying more upfront each month for that rock-solid stability. You also have a few more pieces to manage since you'll need to sign up for a separate Part D prescription plan, and if you want dental or vision, those are separate policies too. So, does that sound like you? This path is pretty much perfect if you put a high value on total freedom in choosing your doctors, if you travel a lot or live in 2 different states, or if your number one goal is just having stable, predictable medical costs with absolutely no surprises. Okay, let's head back to that fork in the road and look at the other option. Path 2, the Medicare Advantage plan. The best way to think about this one is as the all-in-one bundled option. The main attraction of Medicare Advantage is all about cost and convenience. A lot of these plans have very low, sometimes even $0 monthly premiums. Plus, they often bundle in all those extras that original Medicare doesn't cover, like routine dental, vision, hearing, and prescriptions. Everything gets wrapped up into one simple plan with one card. So what's the catch? Well, it really comes down to structure and limitations. You're usually restricted to a local network of doctors and hospitals. If you go out of network, it can get really expensive or might not be covered at all. You might also need to get permission or prior authorization from the insurance company for certain tests or procedures. And while those monthly premiums are low, your out-of-pocket costs can really add up if you have a major health event.
This path can be a fantastic fit if you're on a tighter budget and need to keep that monthly premium as low as possible. The key, and this is crucial, is to first check that your trusted doctors and hospitals are actually in the plan's network. If they are, and you like the idea of having everything bundled together, this could be a great choice for you.
Okay, so once you've figured out which main path you're leaning towards, either Medigap or Medicare Advantage, there are just a couple of final puzzle pieces to lock in to make sure you're totally covered.
So if you chose that Medigap path, you'll need a separate Part D plan for your prescriptions. The process is actually pretty simple. You just go to Medicare.gov, use their tool, punch in your specific medications, and it'll show you all the plans that cover them. Here's a pro tip. Always look at the total annual cost. That's the premium plus your copays. Don't just look at the monthly premium. And of course, make sure your local pharmacy is in network. Now, this is a really common point of confusion. It is so important to remember that Original Medicare, your Parts A and B, does not cover routine stuff like dental cleanings, fillings, eye exams, or glasses. This is a gap you're definitely going to want to fill. So how do you get that coverage? Well, you've got three main options. You can buy separate standalone insurance policies for dental and vision, or, like we just talked about, you can pick a Medicare Advantage plan that already has those benefits bundled right in. A third option is a discount program, which isn't exactly insurance, but it can help lower your costs.
Whew. Okay, we've covered a ton of ground here, from your special enrollment period all the way to the two main paths you can take. Now let's just boil it all down to the final choice.
Ultimately, it really comes down to this. If your top priority is flexibility to see any doctor, having super predictable costs, and the freedom to travel, then the Medigap Plus Part D path is probably your best bet. But if your main goal is the lowest possible monthly premium and the convenience of having everything in one simple package, then a Medicare Advantage plan is likely the way to go. I know this framework helps, but trying to apply it to the dozens of different plans available right in your own zip code, well, it can still feel like a lot. The good news is you absolutely do not have to figure this out by yourself. At The Annuity Expert, this is what we do. We specialize in helping people just like you compare all of their options side by side so you can see exactly how the costs and benefits stack up for your situation. And our service is completely free to you. There's no charge, no obligation to get personalized quotes and unbiased advice. You can give us a call at 770-755-1565. We're just here to help you find the plan that offers the absolute best value for your specific needs. Look, losing a job is a huge challenge, but it's also an opportunity to take complete control of your health care. By using your special enrollment period wisely, you can lock in a plan that protects both your health and your finances, and that's going to give you true peace of mind for the years ahead. Thanks for watching.